Hey everybody, how are you doing? My name is Jordan, and I've had the idea to make this video for quite a long time, and I'm just really kind of getting around to it. But I want to talk about something that's kind of touchy that not many people want to talk about. But I think that talking about it is maybe the best thing for it, and that's something that everybody knows exists, everybody knows is real, but that's about all we know about it, and it's depression. Just to start, I'll let you know that I suffer from it. I have really bad depression. As a matter of fact, I'll be frank with you, is that I just dropped out of college again because my depression was keeping me from being able to participate and enjoy and learn at the level of which I deserve to be. It sucks, but I know that getting my mental health stabilized is the thing that I have to focus on the most right now. I'm sure a lot of you, if anybody watches this, it might be in a similar situation. It might not be as severe for you guys, but I struggle with depression and anxiety daily, and it impacts me daily. And so I just want to talk a little bit about what it is, some treatments you might not maybe know about, or how to go about them, and then just some, just little bits of advice that everybody needs to hear. First off, what is depression? It's extreme sadness. But that's not true. That's not what it is at all. Depression almost has nothing to do with sadness. It can be triggered by trauma that stems from sadness. And they're very codependent. They work very well together, but they're completely different. Depression can make you sad, but simply sadness cannot make you depressed. I know one thing that affects me the most is that whenever I have a very depressive day, which, again, if you don't know me, I've had a very easy life. I've had no trauma, nothing that I wasn't abused, I wasn't treated improperly. I just genetically got a bad set of genes that gives me a nice, strong case of depression. It's different for everybody, so you gotta realize that you can be depressed or you can be sad. You can be both, but understanding the difference is something that a lot of people don't connect, I guess. One thing that really sucks about depression is that every doctor in the world will tell you that it's a real thing, that it's an illness just like anything else. It is, like, they can test for it almost. They can see chemical deficiencies, they can see neurotransmitter problems. I don't know the specifics, but I know that a person can look at a depressed brain and notice the difference between a healthy brain, just like it would be if it was cancer or dementia or a stroke or something. It's something that they can look at a test and kind of see. And if they can't see it itself, they can see the damage that it does do to the brain. The thing that makes depression so weird to talk about is that depression is a mindset, but it's a mindset that's completely determined by us. Same kind of goes along with anxiety. If you look at anxiety, it is the same chemical reaction, the same bodily reaction that is excitement, but it's simply that our brain perceives it differently than excitement and makes it miserable. It is a mental illness that almost only affects the body, and people have a hard time seeing that, and it's what makes it so hard to diagnose and treat for everyone, because everybody's so different. Depression can be caused by trauma, like I said, or chemical imbalance. I know a lot of research is going into medications that can help your neurotransmitters receive serotonin and the other feel-good chemicals better, but it's all more individual than that, including environmental. First thing I want to say is that if you feel like you have any of these, any sort of depressive symptoms, any sort of anxiety symptoms, don't just sit around and try to fight through it. I mean, some people can do that, but why? Like, why do that? Why go into something that you don't really know much about, the doctors don't really know much about, and try to conquer it by yourself? Some people can pull through, but a lot of people make it worse. So the first thing that I'm going to say is look for help. Ask somebody. Ask anybody. Many times I've gone on Reddit and just been like, hey, I'm a 24-year-old failure who's suffering with depression and anxiety, like, what do I do? And you would be surprised at how many people can relate to something similar and can give good advice. It's just the moment that you actually realize that it's a problem, and it's a problem that people can help you with, and you make the effort to start getting better, then you're going to start getting better. Like we said, it's a whole mindset thing. So the moral of this is try things. Set up a time with a therapist, just talk to her and have her evaluate you, see what she thinks, and go from there. They might want to try you on medication or therapy, or just talking, checking in every once in a while. It might not be a big deal, but then it could also be that you go in there one day, they evaluate you and be like, oh yeah, we know, we've seen this plenty of times, we'll try you on this medication and see how it works. And that medication could change your life. It could be the answer to everything that you've asked. Why me? Why now? What did I do to get this way? It's finding the one that will not only affect your symptoms, but will affect the root of the problem at the same time. And so I just want to stress that if you feel anything like this, don't think that you're weak because you need help. Look into it as that you were smart enough to know that this is a problem, and that you wanted to do the best you could to help yourself. That's what getting help is. You wouldn't know that you had your wisdom teeth coming in, and you knew it was coming. You knew it was there. You wouldn't just let it happen and let the pain go by, and you have this set of ugly teeth pushing through your gums and just be like, nah, it'll pass. No, you would ask somebody to help you to cut those things out of there and get back to being normal. Don't think of depression as anything different. Depression wants you not to try to fight back. That's the easiest thing to do when you're depressed, is just to be like, it'll pass. I might have a couple bad days or weeks or whatever. Not a big deal. It's not the case. That's what it wants you to do. So all I'm basically saying is just ask questions. Read up on it. That's all. I watched a good TED Talk that I'll put in the description of this video. This brilliant guy talking about this is what he said. He said that if you have brain cancer and you tell yourself that sitting on your head for 20 minutes a day is the cure for brain cancer. Well, I hate to be the one to tell you this, but odds are the cancer is probably still going to win. But if you look at it in the sense of depression, if you say that standing on my head 20 minutes a day cures my depression, then it does. That's what's weird about it, is that if you can find what stops you from having those depressed feelings, then you've cured yourself. But you won't find those things if you don't ask around and you don't know what your options are. One of the reasons I'm making this video is because I feel that sometimes just hearing things in a different way or different wording, sometimes things can click. I know it has for me. I know hearing that from that TED Talk, I was like, that kind of does make sense. It doesn't cure my problem, but it puts it in a different light where it makes depression look weaker to me. I hope that makes sense. Because for a long time, I thought that I was just going to have to live with depression. But it's as simple as, if I can find what causes me to not be depressed anymore, then it's not there anymore. That's pretty great. So to basically wrap it up, what I want to say is that depression sucks. It really does suck. But I can tell you right now that depression is not game ending. The thing that makes depression game ending to a lot of people is that the depression gets in their brain and it causes them to make bad decisions. And you know what I'm talking about. But depression is not a life-ending disease. I want you to think of it as like this. I like to think of depression not as something that impacts my total potential. It doesn't take away from who I am. The only thing that it does right now is that it impacts my timing, with school, with where I want to live, where I want to be in the next 5 years, where, if I want to ever get married or have kids. Depression won't prevent me from doing any of those things, but it might impact my timing a little bit. So I think that might be a better way to look at it. Anyway, I hope maybe at least one person heard something in this video that maybe switched a light on in how they view their depression. But even whenever you feel that you're at your worst, just know that depression is beatable. No matter how many times in your head it'll tell you that it's not going anywhere, that it's getting worse, that you're hopeless, when you feel the guilt and the alone, just know that depression does not mean... Depression is not game ending. It is just simply an inconvenience that messes with your timing and your placement, but does not diminish the person you can be. Just remember that. Thanks for watching.